Hey, how are you?
I'm so good. Thanks so much for having me on your live.
Thanks so much for coming and super on time. You were here like
so, what time is it in South Africa?
So it's 7:30, yeah. 7:30 at night. So and I got that email. I was like, what time is it there? So I Googled what time is it in Pasadena if it's 12 o'clock at night here. So when I got the email, it was at 3:30. So yeah. I think you guys are also a day behind, like, at some point. So, but I'm so happy you can join me today. And, welcome, Dr. Kay Durairaj on our lockdown live series. And we are so proud and chuffed to have you on. You have so many accolades. You completed your surgical training at UCLA, and you're a member of the American Academy of Facial and Reconstructive Plastic Surgery, hey? And then besides the surgical, the plastic surgery aspect of the neck lifts, facelifts, blepharoplasties, rhinoplasties, you're also a fully qualified head and neck surgeon. So full gambit of ENT specialties from cancers of the head to snoring and sleep apnea. Plus, everything. Plus, you're a scientist, artist in terms of the non-surgical work you do, the toxins, the fillers, KOL for many of the companies. And interestingly enough, you're also an ace at the sculpture butt lift as well. So you don't have sculpture here at the moment, but it's so great to welcome you. Thank you so much. And you guys are also in lockdown in Pasadena, and I'm an avid listener of your podcast. And one of the things you said was, yes, it's really tough, but put your big girl pants on and get motivated. So what sort of things are motivating you at the moment? What are you doing to be motivated?
I think it's been a really good time for reassessing my life in general. So I was working so hard and so full force that I didn't even take time to inventory what I was doing and just like saying yes, yes, yes to every opportunity. And so this little pause has made me just reflect on life and like, what am I doing that I really enjoy? I want to do more of that. What am I doing that's really successful and productive at work? Let's hone in on that. So I like this. It's been a fun time to just like exercise every single day. So I'm staying motivated by exercising. I am coming into the office. We are an essential office since I do head and neck surgery. We have some virtual patients. Just seeing patients virtually is good, and being with the staff and creating more content. I'm staying inspired by like trying to be a positive force for all the injectors out there and cosmetic surgeons and people in our field who feel very impacted by this, because of course nobody's doing these non-essential things. I think beauty is essential, and I think more than ever, being at home and letting yourself look all blah is affecting our psyches, and it just emphasizes even more that it matters how we look. It does matter because it affects our psyche and makes us feel apathetic and lazy and not motivated when we don't put any effort in for ourselves. So, and thinking more. Okay, great. And then, we're calling it lockdown phase at the moment because of the lack of sleep and all the types of food everyone seems to be making while on lockdown. It's having a profound, not a good effect on our skin. And also, people are letting go their sunscreen use because they think they're indoors. But what would you say would be important to use at home? What are your top tips of skincare and taking care of yourself while you're at home so you feel good? Like you said, it's really important to look good and feel good on the inside. I am definitely doing a lot of exfoliating, and I actually developed a pretty at-home peel, which has been wildly successful because everybody has downtime. They're not really going out, so I've done a couple of home peels, which has been so fun, and I'm sending it out to patients. We're doing a FaceTime consultation, and I'm walking them through the steps of how to apply everything. So that was fun. I've done a lot of home improvement projects. I did platelet-rich plasma for my hair and doing my skin, and then just this is a great time to develop a really comprehensive skincare regimen because you have time to put on several products. I love doing this lymphatic massage in the mornings when I wake up. And I fully agree with you that we are getting lockdown phase because I think it's the cortisol. I was trying to analyze myself, like, why do I feel more doughy and puffy and bloaty and like I just feel frumpy because I think it's just this constant stress, staying up late, not having a good sleep cycle, eating irregularly, and just the cortisol levels are starting to affect us all, I think. So these little steps that I'm doing that's the maximum I can do is try to get a little exercise, get the blood flowing, doing some exfoliation with either a scrub or a peel, using my Retin-A at night, all the good things. Mm-hmm.
What what's it called? The Retin-A Diamond Line? What's the name of your...
Called Diamond, it's Diamond Line Refine. It's really excellent. It's got a combination of hyaluronic plus all the green tea polyphenols, which are soothing, so you don't get that inflammation from Retin-A. So that one's excellent. Are you on Retin-A yourself, hopefully?
I do have one, but I haven't used it while we've been on quarantine. I've got a SkinCeuticals retinol, and we also have Zoe available here, but that's quite intense. So at the moment, I'm on a SkinCeuticals 1% retinol. Yeah.
Okay,
so, you're doing.
I'm sorry. I was gonna say I don't even really know very much about you. Do you tell me about yourself a little bit?
Great. So I'm an aesthetic doctor in South Africa and currently practice in Johannesburg. I've been doing aesthetics, but only non-surgical work for the past 10 years, and mainly toxins, fillers, microneedling, peels, that sort of thing. My thing is we do PRP, but I like doing PRF in the office, the injectable PRF. That's our favorite treatment, a real favorite with our patients. And currently, we have not been doing anything for the past 6 weeks, and we had a very firm lockdown in South Africa, and no dog walking, no alcohol, nothing. We just had to stay at home, and it was called phase 5, and now we're going into phase 4. So a little bit more of the essential services. And I don't know what that means. So a lot of the aesthetic doctors don't know, are they essential services or not? So nobody knows what's going to happen next week. Should they start seeing patients or not? But I also work for the States in my country. So then I have been going in, which has been pretty scary because you look, you're so used to just, if you look at your injection videos, all of us just inject, we look pretty and injecting, but when you now in PPE, you look like a stormtrooper, like from Star Wars or something. Yes. So it's such a change. And so we kind of nervous about what we're going to do next week, protocols. And it's when you deal with patients like this with aesthetics, it's not just injections, it's the psychology, it's the way you treat them when they're at your practice. Sometimes even if they just come buy a product, they'll sit for a cup of tea or whatever, and we can't even do that anymore. So I don't know when we'll get to do it, but we've been also moving with the times. Slowly moving with the times. We've had to adapt. And I was also going to ask you, in terms of we call telemedicine or virtual consulting, was it common in the States before? It depends on the state, I suppose, because with us it was completely prohibited. There was no virtual consults or telemedicine, and then our medical council very quickly for this time lifted that ban. So now we're also trying to learn how to teleconsult.
It's been around in the United States. We've used it for rural communities, and it's been around on the periphery, but this has brought it center stage. And it's been a good thing. I think people really understand and enjoy how to do it, and it's fast and focused. Like, you never get your doctor's attention for 15 minutes straight on, where you can ask every question, and the visits are more efficient because you run out of things to say. Like they ask all their questions and they're done, and you can glean quite a lot of information, I think, from just chatting and looking at someone. But for my field, it's hard to look in people's ears and in their noses.
Yes.
You can kind of see their throats. So there are some things that we still have to do in person. But I like the telemedicine. I do like the ability to chat and get an idea of how people are doing. Yeah. Do you have kids?
Yes, I do. I've got a 1-year-old son and a 7-year-old daughter. So, so they in the front there, they're very quiet with their dad. So, but yeah, it's been. I've actually appreciated this time at home with them because I was always working. It's practically like having 2 or 3 different jobs, and you just work for very long hours. And I guess the children got used to it because that was their normal life. And next week when we're in phase 4, I'm almost like apprehensive to go back to normal. I don't think I want to go back to normal.
They're going to go back to school next week or not yet?
No. So there was just I think it's been taking a while, but the government was announcing what they're thinking of doing. So the oldest grade in high school will probably go back, and then we've got like the primary school, the highest grade in the primary school will go back maybe. So a staged approach, and I think my little one will only go back in July. So. And the little dude had the nanny, which we miss very much. So, yeah. And I know you've got 4 kids. How are they? Are they all together with you at home?
Yeah, they are. I have older kids who are older than yours, but I have twins, a boy and a girl, and they are turning 21 tomorrow on lockdown at home. So how sad for them. They were both of them were study abroad in Europe, so they had to be brought home. And very sad. My daughter was crying because she was supposed to turn 21 and be in Paris for her 21st. And she's stuck at home with her mother having champagne tomorrow. And then I have 2 others that have 3 in college and 1 who's in 9th grade. And everybody's home, and it's very fun to have them home, but it also feels like it's very much disruptive to kids and their social growth. Yeah. Where they're supposed to be in their lives, but what can you do?
I know. So they, it's kind of weird to listen to a 7-year-old talk about Zoom meetings and MS Teams because that's how they school now. And today she wore like a really fancy jumpsuit and my heels for her school Zoom meeting. And she's so excited because they do it once a week. They do a lot of homeschooling, and then once a week they meet, like chat with their teachers. So she actually got dressed up for that. And my little guy also turned 1 while we were in lockdown, and we had the time, so we actually did like a cake smash for him, but in our garden. It has been fun, after accepting what's going on, and like I was telling my husband, just hustling and trying to make the best of it, so because that's all you can do.
Are your patients ready to come back in? Because I definitely have people who are ready to come do their filler, their sculpture for their butt.
Yes,
they're all asking, like, are you open? Because this is great to have downtime right now and get things done. I'm like, I wish. I wish we could.
I know, taking hands, like, please, can I please come in for, and it's so difficult to say no, but I suppose for our safety and their safety for now, we have to say no, and all of us are trying to figure out what we're going to do next week. I don't know, like the ethical dilemma.
Are you going to just wear an N95 mask, a goggle? Are you going to do anything more extensive than
that? Well, because at the state we kit up fully in the gowns and all of that, I'll probably, for myself, have a gown, a shield, goggles, and if I can, an N95 or so close to their faces. And for my staff, we also a shield, and we'll probably have like perspex in front. It's so different, and also a masks and. Yeah, that's what. And then you have to change out of your clothes before you go home. So yeah, we're just working on our protocols, on what to do. And also before the patient comes in, they'll probably have to fill in. There's going to be so much screening before they come in, and sign a consent that they understand the risks. And it's very different. It'll be different. So we're going to work on all of that this weekend, actually. So, and that's the way I'm getting to. I was actually going to ask you what you think, like post lockdown, because it's not going to really be easy. What do you think the trend is going to be in terms of, well, I suppose the head and neck surgery and also the aesthetics? What do you think is going to happen? And what do you think people will still be coming? Will there be a change in what they want to do? What do you think?
Yeah, I think people are still going to probably save money and still come and value their appearance, because that's something that presents itself to you every day in the mirror and every day on your phone and in your Zoom meetings. The more Zoom meetings we have, the more we're going to care about how good our skin looks, and having good quality skin instead of tons of makeup is going to be the new normal. I think people are going to really invest in skincare because it's difficult to wear a lot of makeup with a mask. And you just want to be able to not throw on all that gunk every day, because you just need to be able to wash your face and be clean. And so I think good skin is going to be a huge trend. And I also think people will definitely want to maintain their toxins, especially upper face beauty. And I don't see a change in filler. I think people will save and come in for their 2 or 3 times a year. And if I'm a woman, I'd rather use all that money that we used to use going out and going to Starbucks and doing silly things and save that just for my face and my important splurges. So I think that's going to be maybe slightly less, but it's still very important for people. We've all seen the importance of good, getting our hair done, getting our nails done, maintaining our faces more than ever. When we let things go, we feel like crap. So it's very important to show up for ourselves and invest in ourselves with these little things that maintain our self-esteem. I think it's important. So I predict that it'll be slightly less because, of course, there's the economics of it, and certain people don't have the funding. But I think that we can offer something at every level, whether it just be skincare at a lower purchase point or a toxin or a filler. Everyone will find what makes them happy and comfortable. But I think that our field is grossly lacking in leadership. I feel that nobody in our societies has stepped forward to say that Botox and fillers and aesthetic treatments are essential and normal and proper part of life. We feel very marginalized right now, and I think it's something that needs to be stated that yes, it is important to look good, and people are affected and they are feeling depressed. And just as much as grocery stores are essential, it's essential for self-care. And it might feel and sound superficial, but beauty is important. The human pursuit of beauty is centuries and hundreds of years old, and it really matters. So I think that that's something that someone in our leadership needs to step up and say that. I'm going to say it myself. But like you said, setting guidelines, telling us what's essential, saying that it's okay to go forward. If a neurologist can administer Botox for migraines, then why can't we? Because no one would say, let's let someone suffer for 3 months with migraine headaches because of quarantine. Those can be quite severe. You can have to go to the emergency room. They're very disabling. So by the same token, people should be allowed to choose this too.
No, I agree with you. And I think with us, it's also, like you say, the industry is very disjointed and maybe not united enough to say that, because there are differing opinions. That's why nobody really knows what they're going to do and what is right according to our law, because we in a state of disaster level 4 where we don't know what that really means. And people are saying aesthetics really essential. It's not an essential service because, it's not life-threatening if you don't. But, there are other aspects besides just death. Like you say, it's the mental health of a patient. That's very, very important as well. Yeah. And then
once we get to the point where we realize that hospitals are not overwhelmed, that there's some protective equipment for everyone who needs to see patients in practice, then it makes it more reasonable. of course, like, we're not going to put beauty over life and death, but, you know, we will stabilize and we'll reach a point, and keeping our staff employed and not demolishing an entire sector of the economy and not making a whole jobless situation is very important. So
yeah, I totally agree with you. Yeah, that's the struggle we're in now. That's the struggle. So at the beginning, everyone was very for the lockdown, and then it was extended, and then you could see I called it that kumbaya feeling, just sort of flattened out. And people were like, oh, you know, what about the economy and jobs and my staff and my house? And you're completely correct. And then in terms of, okay, so you were telling me what you're doing at home, but you know, you've got some interesting ideas and thoughts. And I was talking about sunscreen at home, and one of the things, you know, and also we're talking about lockdown phase and your sleep being messed up. And you've spoken about it before, is blue light exposure. And now that everyone is at home, out of the actual sun, but in front of their phones and computers, and we've got this intense exposure to blue light. What can we do? What can people do so when they do leave lockdown, they don't find themselves, you know, their sleep patterns completely damaged as well as their skin? What advice would you have for us?
Oh, very interesting. I did a podcast this week, which will come out in a couple weeks, with a guy named The Light Diet on Instagram. And he also is a big believer in this. I mean, the fact is that when you have a blue light screen, whether it's your television, your computer, your phone, or the ultraviolet, like the fluorescent lighting from above, it's going to disrupt your pineal gland, which regulates the amount of melatonin that you produce, which impacts your sleep greatly. And melatonin also is implicated in just the immune system strength. So the fact is that we're in a Zoom meeting the entire whole day, and then when it's time for recreation, we go to a Netflix, and then when it's time for like communication, we go to our apps or Instagram or FaceTime with our mom. And so we're never off of blue light, and that's definitely affecting your sleep patterns. So I think blue light glasses are very important because they can filter the light. So if you are going to be on a screen, at least you're deflecting away the bad blue light rays, which can impact your melatonin levels. And then as well as like trying to sleep in total darkness, trying to wake up and enjoy the early morning sunrise sunlight and the golden hour at the end of the day. So you're getting outdoor beautiful infrared energy and heat from the sun without the intensity of the ultraviolet. Using sunscreen on areas that are valuable real estate, like the face, but allowing sun itself to touch your back and your arms and your legs, where you're going to absorb and convert and make vitamin D, which is so important for the immune system and for fighting COVID. So I think that we do need to change and kind of even go back into like old school, where we wake up with the sun, we go to bed with the sun, we get that early exposures, avoid the midday light. And then use your blue light glasses when we have artificial light hitting us so intensely all the time. Because we are the test generation for all this technology. Like, imagine our ancestors didn't have it. In the pioneer days, they didn't have it. They had to, you know, kind of rise with the sun and sleep and live by candlelight, live by firelight. So I think that's so important. And I definitely feel like my sleep cycle is wrecked. Also, my brain is hyper vigilant. Like, I'm scanning the internet all the time and looking at what's going on with different, you know, research that's coming out and keeping abreast of what's going on. So
honestly, I also feel like almost busier than I was before, and we're calling it our webinar FOMO, and we're trying to record them and watch them. And you're talking about blue light glasses, and I wear them every day, but it looks quite freaky, you know, when you've got the blue light glasses on, the orange ones. I've got those.
Yeah, those are good. Need to be.
It looks really scary. Nobody really knows what I look like under all of that. And it really disturbs me. My husband always laughs at me about the blue light and the fluorescent light, but it actually like mentally gets to me. I can't deal with it. And this is from when I read something when I was in high school about fluorescent light and UVC and all of that. And when you're young and impressionable, you know, you get an idea. And I almost actually developed a phobia for a while until I relaxed a bit. But yes, it does really I think it really does affect you, yeah. And then
It
someone
really does.
about chin filler. If a patient has had chin filler, how long should it last, and what are the factors that reduce the duration of like it lasts its longevity? Well, Ash is asking.
Well, typically it depends on the type of filler. Mostly these are 1 year or 2 year hyaluronic gel fillers, like the Juvederm Voluma would be 2 years. It depends what you've had placed. The factors that affect it would certainly be your own metabolism, your muscle contractions around that area. And in general, they break down at 1 year, you'll be 50% of it will be metabolized. So it's something you'll repeat. It's best to layer on instead of waiting till the end when it's all gone. So yeah, all of these fillers are temporary. I encourage patients a lot of times to think about Sculptra and these other fillers that are biostimulatory because they do create some of your own collagen. Even Radiesse, when I use Radiesse in the chin, the calcium hydroxyapatite products grow some of their own collagen, which maintains. So that's another thought. Another, probably forecasting another trend would be using biostimulatory fillers to have more long-term collagenization versus the temporary hyaluronics. And but it's been so fun chatting with you.
Just leave us with a positive message. That's our tradition here on Lockdown Live. I guess always leave us with something awesome and positive to go home with. Thank you so much for chatting with me, please.
Yeah, I hope you come visit me if you're ever in LA. And I want to encourage everybody out there, just put your big girl pants on. Life is going to gradually go back to normal, but it's going to be a year before we expect that. And I just want to remind people, even though we're wearing masks, to have good etiquette and make good eye contact, because I feel like we're all running around like hiding from each other. So.
Thank you so much. Yeah. Thanks, Dr. Kay. It was awesome speaking, and hope your twins enjoy their birthday tomorrow. I hope they have a spectacular.
Thank you. I look forward to meeting you someday when travel restrictions are lifted. But
definitely,
love for LA, everybody. Thank you again.
Thank you. Bye. Bye-bye.